Welcome viewers to the next episode of Marketing in the Never Normal, where we've been talking to industry leaders to understand the disruption that's happened in their industry and how marketing is changing in a post-COVID world. Today, we have with us Jasrita Dhir. So she heads brand marketing and CSR for Fortis Healthcare Group. Welcome, Jasrita.
Thank you, Karthik. Thank you for having me here.
Our pleasure. So Jasrita, the healthcare sector has been in the thick of things with the COVID situation which has happened right now. So what are some challenges that you're seeing currently, and what are some business challenges that you think will continue in probably the short and the mid-term as well?
Right. See, the challenges are on three counts, like you mentioned, there are organizational level challenges. Okay. First of all, before I begin, I think I need to put out a disclaimer. Views are personal. It's not, organizational views. Sure. So we need to just put out that disclaimer. Sure. So see at a business and at an organization, at an entity level, there are challenges. There are challenges which are at an employee's level, because at the end of the day, an organization is brick and mortar and it's employees who are running it. And then there are challenges which are at a consumer level, because of course, your marketing and your that is who you work for, right, at the end of the day. So if you talk about an organizational level challenges, I think increasing costs and dipping revenues, right? That has been a story that you must be hearing, that's almost, a constant refrain everywhere. But if I speak about healthcare industry overall, I mean, the way costs have skyrocketed with whether it's the personal protective equipment or to sanitize, over sanitize your environment. So all those costs have gone up manifold, but your revenues have dipped considerably, right? So I think that is an organizational challenge, and that is going to continue for some time. So this is something which, at least in the short to mid-term, is going to be there. Of course, in the long term, everything will be fine. So that's at an entity level. If we talk about at an employees level, then I think, again, for healthcare workers and even non-healthcare workers in healthcare which are working in a hospital setup, safety has been a big concern. Okay? Everyone would have vulnerable populations back home. If you're in that productive age group, then either you have children under 10 years of age or aging parents with you. So the fear of carrying the virus back home, that's safety, and yet find the motivation within you every day to show up at work, where, a lot of people can have the luxury and should have, exercise the work from home. But for some, it's that essentially healthcare workers and also non-healthcare workers, which are support staff. So think, the call center staff or the patient experience people, they don't have that luxury. So I think this dual, finding that safety, worrying for your safety and yet finding the motivation within is something that I think at an employee level has been a challenge. Okay. Until the time you're not able to sort of flatten the curve, till the time you're not on the descent, which doesn't seem, in sight as of now. Until the time you don't have either herd immunity or the vaccine, right, which is available at a mass level. I think, again, till such time, at an employee level also, this challenge is going to continue in healthcare, right? And I speak about healthcare, whether it is government sector, public or private, okay, because this pervades, it's not organizational. And then at a consumer level, of course, there is this fear. There is fear of stepping out. There is this anxiety of, should I get this procedure done? Can I set it off for the future? And countries which have seen where the virus has done the rounds before reaching India. If you look at those, Lancet or some organization, I don't remember, but it did a study which was, carried out in one of the leading publications, which said that from Madrid to Milan, to UK, to Manhattan, the story is the same, that there are a lot of people who are dying at homes with strokes and heart attacks, right? So you should not be dying at homes with strokes and heart attacks. So what does that tell? What that tells is that the fear of the virus and the anxiety with the virus is far more than the actual pressing concern at hand, which is, impeding people from sort of getting care or accessing care or reaching out to care. So I believe that fear, that anxiety, and that disruption which is happening in their care. So there are certain things which COVID or no COVID, pandemic or no pandemic, cannot wait. Babies will have to be born. A cancer patient needs a chemotherapy session. Somebody who's on dialysis needs that dialysis session. So when overnight your hospital becomes a dedicated COVID center, and your next healthcare facility is, let's say, 10 kilometers away, where do you go? Where do you go? So that disruption in your care, we saw that in some hospitals, some of our hospitals in Bombay. Now we're seeing that in Delhi, that's happening. So I think that disruption in the whole continuum of care is on the consumer side, some of the bigger issues. And again, to sound, repetitive, but at least in the short term to the midterm, one sees these challenges to be around.
Okay. So thanks. That was like a good perspective at three levels that you've said how this has kind of impacted or disrupted the industry. We've also been seeing that there's a lot more focus now moving towards telemedicine and how that disruption of health tech that's happening in this space now, or probably the adoption of that is kind of activated right now. So what do you think? How that could probably act as a differentiator for healthcare brands moving forward?
Absolutely. And here one needed the government to play ball as well, which they did. So let's go back to when the lockdown was announced, which is around 23rd, 24th of March. Till such time, and we know that healthcare is a state subject in our country. So till such time, telemedicine or the virtual consults did not have the blessings, so to say, of the government. There was this gray area, and a gray area in which some users were operating and some others decided to, err on the side of caution. So Fortis was the one which decided to err on the side of caution and said, no, till the time it is not legit, till the time it's not kosher, we are not doing it. But as the lockdown was announced, which is I think on the 24th of March, 27th midnight is when we launched our e-consults platform. So within 48 to 72 hours, the e-consults platform was up. And again, here as a marketer, what you have to think, I'll take, before we go to the consumer side again, I said, let's talk about it internally, because what made that happen in those 48 to 72 hours, aside from obviously a whole lot of people burning the proverbial midnight oil, beyond that, right? I think a little bit of foresight, so while there is a law which needs to change, which will eventually change, right? Looking at the scale of the issue, but I think a little bit of foresight and forecasting sort of needs to come in here as marketeers or any professional to say, we see this coming and better be prepared at the back end for it, better do the spade work. So that's point number one. Second, I think collaboration, because when you're dealing with a virus of this scale, you're not going to be able to do everything yourself. And therefore, this cross-functional collaboration becomes very important. And in our organization, this was a joint KPI of the CMO and the CIO. So the IT and the marketing teams sort of worked, in tandem, along with obviously medical strategy and operations group, because, it's to do with doctors, so you have to involve. So it's like these three teams that worked in tandem. So I think cross-functional collaboration, very, very important. And thereafter, we launched the platform. And here one has to think, you have to think about not the best solution, which is there, right? But what do you have at this point in time? Because you're dealing with a crisis, right? What is it that you can scale up at this point in time to be able to do it? So we just extended our internal collaboration tool that we have to be able to extend telemedicine services for our patients. Okay. Also for people who are going to be able to deliver it on the the hospital staff side, whether it's the call center people or the coordination staff of doctors, etc. You don't want to disrupt their world completely. You don't want to bring in a new animal in their life and first tell them how to, use it. It's not happening. They're dealing with a virus, right? They're dealing with those loads and those numbers. So you also have to ensure that there is least bit of disruption for them, so that the adoption is sort of easier, right? These three things we sort of kept in mind. And like I said, just extended our internal collaboration tool, which is Microsoft Teams. and launched our platform on 27th, right?
Okay.
From now, if we look at it, we are close to, in fact, we've crossed 30,000 e-consults in this much time, that has happened.
Okay.
What helped is, like I said, that the government, within days, we had every state medical council sending out and saying that for the period of the pandemic, virtual consults are the way to go. And today, now that the government has come up with a Gazette notification of those telemedicine guidelines, which came about a month ago, in fact, now the government is also saying that for your follow-up consults, please follow telemedicine, right? So why should a person have to travel, let's say, 50 kilometers another state, and come for a follow-up consult, right? A follow-up consult is something that, telemedicine should be able to plug in that gap, right? Other chronic diseases, we know that there are certain vulnerable populations. So for vulnerable populations, you don't have to be in the hospital corridors, right? You see a doctor once, and then for your chronic disease management, with the help of wearables, with the help of the IoT, we should be able to, like a blood sugar monitor, which a doctor should be able to say, hey, listen, chap, your sugars are in control and you don't need to come for, and I'll see you in 3 months or whatever it is, right? Or for hypertension and things like that. So therefore, I think all of us moved pretty fast, other competitors also followed suit. Technology adoption, you have to handhold. You have to handhold in the beginning, especially when you're consumer. I mean, who's a consumer of healthcare? The healthcare consumer is going to be people who are elderly, right? Not very young people. Aside from the birthing segment, right, which is a young population, but every other segment, whether it is heart disease or stroke or whatever, are people above 55, right? So again, I think you have to be patient, you have to handhold, you have to disrupt their world the least bit. And that is again where, as as marketers and communicators, we come in, where we put up those very like tutorial sort of videos on YouTube, which are still there, which says, go here, click here, this is the kind of icon that you will see. And make it as, language agnostic, as sort of age agnostic as you can, and put that information out. So yes, this is a very long answer to your short question, but I thought that bringing that perspective was important, that telemedicine is here to stay. It will become a way of life. It should be the preferred for, like I said, certain segments, certain populations for a certain demographic. And we are going to see more and more innovation and both adoption in this area. And marketers and communicators need to step in and help in that hand-holding process with the right communication needs.
Okay, I think this question actually required this kind of response, because the effort which has gone in, and kudos to the team for pulling it off in record time, and then congrats also on the numbers that you guys have clocked. So you ended on a note which said the role of marketeers becomes all the more important here with respect to how do you communicate and what do you communicate, and language becomes an aspect there. So I've also been seeing few of your posts on LinkedIn where you've created some interesting infograph-based tutorials or do's and don'ts for the current season. So what do you see will be the role of content and digital marketing going forward in this post-COVID world?
It's going to assume greater importance. It will come under limelight, because let's talk a bit generic, and then of course one will narrow it down to healthcare, right? A lot of organizations, a lot of brand management people, communicators, marketers will have to find, where does this organization fit in the new normal? Because the axis of control has shifted. It's not that equilibrium. So in the new normal, you find a temporary equilibrium, and on that equilibrium, you have to see, my organization was here, but now it is here, right? So positioning the organization, creating an appreciation for what it brings to the table in the new normal. Why should the consumer care? These are all content, marketing conversations. First content and then content marketing conversations. So I think that's at a generic level, that's going to be the role of content and content marketing. Again, if we go sort of specific, then in content, we'll have to, of course, I mean, this is something you would have heard from others as well, but at the cost of sounding repetitive, I think it needs to be spoken that one will have to think vernacular, one will have to think more video. Healthcare is again one of those industries which is not a digital prime, right? So I mean, it's as an industry level, right? Nowhere else. But in this pandemic, like many other organizations which were digital laggards, etc., you've been forced, or you have had an opportunity to become a digital, early adopter, if nothing else, if not a digital prime. Then you had to learn quick and get it right the first time, because you're dealing with healthcare and it's not another product or service. So therefore, content marketing, beyond the 3 V's that you must have heard and must be coming out of your ears, that it'll have to be vernacular and it'll have to be digital, it'll have to be. I think again here we have to say that now, when should you come to us? You have to go down to basics, right? And break the basics down in a very usable and palatable format by the consumer. You have to tell them when to come to a hospital, how to come to a hospital, how can they ensure that they keep the hospital environment safe, how can they be assured that we are keeping the hospital environment safe for them. Okay, because this I think we've settled that only hospitals can't keep hospitals safe. You need a two-way thing if you want to flatten the curve, right? You have to break it down to that level. So the series that you were talking about, which you might have seen on LinkedIn that we are doing, and on all digital platforms, is living with COVID. Okay, because the virus is not going away anywhere anytime soon. If it is not, then as a leading healthcare provider of the country, we think that it is our responsibility to be able to ease the transition for people. How do we normalize? It's called the new normal, normalized. That's what it's called, right? So how do you normalize the new normal, which is to say, how to open your offices, right? A lot of corporates didn't know in the beginning that how do they reopen the offices and all of that, right? So what steps to take? Now people have to commute, and there is a big fear of commuting, right? But not everyone has a car to commute or a personal vehicle. So how can you commute safely if you're using public transport? How do you operate an ATM? How do you buy groceries? How do you wash clothes at home? How do you, if you are in an environment or in a position that you cannot do away with visitors, okay? For instance, you are a receptionist at a small clinic where patients have to come. You can't say keep social distancing, right? Of course, social distancing, but you can't say that, no, I will not take visitors, right? So how do you manage visitors flow? These are the conversations that as a healthcare organization, we are breaking it down for people, right? Now, 2 years back, if anyone was doing a healthcare conference and, all of us were sitting pharma or healthcare, and somebody said that, listen, you have to break it down to the consumer, how to come to a hospital. I'm sure all of us, including I, would have scoffed at this person and said, come on, why do I have to tell people how to come to a hospital? And, I don't want to sound preachy or whatever, but today you have to do that, right? And also not sound preachy. So I think the role is assuming more importance, but also we have to take a few steps back, do the basic conversation, break it down in a format, whether it is visually or it is, like if you see in our format, it is 2 lines per screen. That's what the format is, because you need to give people those just 8-10 slides for everyone to take in. And a lot of feedback is coming. So the thing with social is that you also get, real-time feedback saying that this is working, okay? And then we have videos that we have created and that we are running it in our hospitals while people are waiting there, okay? We are doing those WhatsApp blasts, etc. So I think the role, again, it's going to become primarily digital. Organic will become very important because, truth to be told, people won't have those kind of budgets to be able to pump in money. Okay, so organic becomes very important. And whenever organic becomes an important conversation, we get back to the adage of content is king. Okay, because good content will always sell. Good content will always have takers. And what is good? Good is something, for my industry, something which is relevant. which is speaking to you at the life stage that you are in the journey, in your disease finding journey or your solution finding journey. So this role will, assume a lot of importance, and gone are the days of just doing blog posts and just doing, paid media, etc. So yeah, very, very important, I think.
And are you moving with vernacular based content also as part of the campaigns?
Yes, we are doing that for our, so this is obviously for the pan India market, but whenever we do specific communication, because Fortis is present in metros as well as in tier 2 cities, so when you go to cities like Amritsar, Ludhiana, those markets, so we're doing a whole lot of vernacular content there.
Interesting. So during this current situation, we've seen that there are a lot of industries which have disrupted, and some of them have really come up with innovative ways of communicating or campaigns that they've run. Anything which caught your attention during this period, which you felt?
I just thought humor. I think everyone needs humor, a dose of humor, right?
Yeah.
And the best kind of humor is the one which comes from wit. I mean, humor can come from a lot of spaces like slapstick and, a banana peel or whatever have you, but the one that comes from wit. And I find that self-deprecating humor can only come from a place of a lot of security of who you are. So I'm sure it went viral on social. So even you might have seen it, Karthik, that when all the airlines were grounded, they did this social media where one handle is tagging another handle of competitor and saying, right? So Indigo is tagging SpiceJet, and SpiceJet is tagging and saying how it is. That was such, pun intended, beautiful wordplay, and self-deprecating humor. It's almost like, these brands are saying, listen, we are grounded, and either we can be soppy about it, or we can just have fun, and at the same time put, set Twitter on fire. So I just thought that was very cool, and that gave people that necessary dose of wit and humor at that point in time, right? So that's one. And overall, I think all the initiatives that Tata Trusts has been doing in this pandemic has been, it's laud-worthy, whatever they're doing, whether it is telling state governments as to what material should be of PPE material, that should be for frontline workers, for nurses, for others, or standardizing when because see, nobody in this pandemic also that has happened is WHO, a CDC, a lot of our institutions have gone back and forth on so HCQS is good or not, right? Fomite infection happens or not, right? So and in all this time, to be able to standardize and then to be able to disseminate and proliferate that information that helps the grassroots workers, in a country which is the size of a continent, I think is laudable. So I believe all the work that the Tata Trust has been doing and is continuing to do is unbelievable, is incredible. So these two, very diametrically opposite with these two.
But equally interesting and capturing the mind share.
Yes. So both are top of mind.
Yeah. So any book that you would? I think you have something else to add.
I was just going to say that when you ask this question of vernacular, I also wanted to tell you that in this pandemic, what has happened is that while we've spoken a lot about the physical issues that happen with the pandemic, one thing that we are seeing is, and again, WHO has said that the next pandemic is going to be in the mental health area, right? So the mental health has taken a toll, even on healthy individuals, okay, because this self-imposed incarceration that's happening. So something that we've been doing, our mental health and behavioral sciences team, is that we're running a stress helpline. And the stress helpline is pro bono, it is free. So it is being run by psychologists in 15 different languages, because when you're stressed, language at that time is the most important, because you want to be able to express yourself in Hindi, Punjabi, Gujarati, whatever your mother tongue is. So we have, psychologists, about a team of about 40 to 60 psychologists, which offer this free counseling in 15 different languages, Indian languages, which is there, right? So here is where the role of sort of content comes in. Here is where the role of relevance and how quickly you can adapt to, what's happening in the environment, and give a solution and a response to it also sort of comes in. So I forgot to mention it then, and I thought I should bring it up now.
And I totally agree. Mental health is going to be a key challenge because, in fact, I'm also a certified life coach and hypnotherapist. So even I've been getting a lot of these calls from clients saying they're mentally disturbed, upset, a lot of uncertainty. They don't know, all they want to do is just talk it out.
Absolutely.
That's all they want. They don't want any solution. They just want to talk it out, and that makes them feel better. And I totally agree. That's a very interesting initiative that you guys are running. So, any book that you've read during these times, or something that you had read earlier and you feel it's very relevant in these times to either motivate people or enable them to think out of the box? Anything that that you would like to suggest to the viewers?
There's a book that I have, it's one of my all-time favorites, and I have reread it during this time, because sometimes when you reread a text, it gives you a perspective that you didn't do it earlier, right? Which is, I think writers do that a lot. They just keep going over their drafts because they pick up a nuance or, a lacuna, which, so not that, but I reread a book. When I read it the first time, I'll get to the book, I'm building a bit of a mystery around it. When I read it the first time, it's set up in a healthcare environment. In the pandemic, where it has forced us to rethink, search for meaning in what we are doing, and made a lot of people understand the real value of things, and realize that we don't need so much of stuff, and what was this mad rat race, etc. I reread that book. And I've got an entirely different perspective. So the one thing that I would like to tell people is that if you have any, your go-to books or your all-time favorite books, I would say just go and reread them right now. If you reread them, the one thing is that you're going to get a perspective which you didn't get earlier. You might just get that. So one is that I'm going to say. And this book that I'm talking about is Dr. Paul Kalanithi's When Breath Becomes Air. So have you read this book?
Yes,
Can I talk about it a little bit? Yes,
you
have, right?
Please
so, yes. So, when you read this book the first time, it's about, you think that perhaps this person is a drifter, he takes up literature, and through literature, he's trying to find the meaning, the purpose of life. And just when he's about to, get that, in flying colors, he decides, no, life, to understand the purpose of life, one has to be faced with death, and you face death in hospital corridors. So not through literature. Literature is very metaphorical and very bookish, and I need to be there in the hospital corridor. So he shifts into medicine, and sure enough, he deals with the paradox of life and death. And just as he thinks that he's making some progress in that his own spiritual journey, is when he comes down with the debilitating illness, and then he's literally, physically, metaphorically, facing death. And when he's doing that, he takes recourse to literature again, which he had given up in the first place, because now that's where he draws strength. And so I think in man's or women's eternal search for meaning in life, this is a seminal work. And a time when you have time for contemplation and some ponderance, I would recommend this book to people. And if this book doesn't interest you for whatever reason, then please go and reread your favorite lists, is what I would say.
True. I think reading your all-time favorite is also a good thing to do, and it definitely gives a new perspective. So, like I reread Man's Search for Meaning by Viktor
Frankl's, yes.
So that again,
that's another one of my all-time favorites. Yes,
where the things
correct, right.
So that's very true. So great, Jasrita. This was very engaging, interesting conversation. So where we could understand how the disruption is going on in the healthcare space, how technology is now going to be a very key enabler for the healthcare sector. A lot of disruption happening there. Good support that's coming in from the government also to push telemedicine forward. And I think from a marketeer's standpoint, communication becoming all the more crucial, and communication which is a lot more basic and which is relevant to the audience that you are talking to at this moment, becoming all the more crucial. So very interesting perspectives. Thanks a lot for your time, and look
Thank
forward
you.
to getting more insights from you in future series. Thank you.
Thank you, Karthik. Thank you. I look forward to more sessions with you. I thoroughly enjoyed my time. Thank you and have a good day ahead.
Thank you.